Hello, everybody. Suzanne Connors with Dawning Visions Hypnosis here to speak to you about a situation that came up certainly for me as I was working in conventional mental health. And one of the reasons that I chose not to go in that direction myself. And that is that too often patients are told that they need to take medication, should take medication, medication can help them. In fact, I was watching a video just yesterday where a woman was speaking about the fact that she was having some issues that had to do with menopause. And her conventional doctor told her to take antidepressants. Now, I was in a similar situation many years ago when I was in a hospital. It was post-hysterectomy, and they put me on antidepressants instead of actually doing the work that needed to be done, which was to check out my sex hormones. If someone has a hysterectomy several years ago, problem probably is more to do with hormones than, shall we say, mental health issues. And indeed, that was, of course, what needed to be taken care of. So, I don't know how it is for you, but I do know that for me, I would rather have my clients be able to find out the cause of their problems. And sometimes they're physiological and sometimes they're emotional. You have to figure out the difference between the two because they can look alike. But it doesn't mean that just because someone looks depressed that they are depressed. They can have hormonal issues. They can have medication side effects. They can have leaky gut. They can have so many different things going on with them that need to be taken under consideration other than just an emotional issue, unless they actually tell you that yes, they're very sad, or yes, they just went through a really hard time. Something that allows you to know that it is most likely emotionally based. And because of that, we need to be a lot more open-minded in terms of how we go about helping our patients deal with their issues. So maybe you do not really like the fact that medication is like the first thing that's spoken of. And I know in some agencies it's actually pushed onto psychologists and mental health professionals to send their patient out to get a psychiatric evaluation and be put on meds. But before Big Pharma took over everything to do with medicine, there was a time when people actually learned how to regulate their emotions. There was a time when people learned how to speak their truth without having to be rude. There was a time when people learned how to deal with life. And they were able to deal with life without having to see people for endless sessions or be on medication for the rest of their life, because it is really hard to get off some of these psychotropic medications. We know that. We always have to tell our patients that they cannot go off these medications without having a psychiatrist help them off them, because they can have really bad withdrawal symptoms. Not a good idea. So we need to think really hard before we have someone take that particular step, if it's truly necessary or not particularly, and they could do without. This is actually something that I learned from my dad, the dentist. He had a dentist practice for 31 years, and he did the minimum work that needed to be done to get the job done. He made a really good living being fair with his patients. He didn't have to oversell anything. And I'll never forget the day that we were in Mount Kisco Diner. I grew up in Mount Kisco, New York, and that's where his practice was. And one of his colleagues came over and asked him how much he was charging for a Spermco crown. And my dad said $375. This is like in the late 70s. And his colleague said, well, you could be charging like $4.25 like I do. And my dad said, I don't need to screw my patients. I make a good living. It's a fair price. So I learned at his side to be fair with people and to not overcharge and to not do things that aren't necessary. Find the cause of the problem. Go from there. Deal with it. Do it holistically, because that's the best way to do it. So I just hope that this particular video gave you something to think about. And if you are working in an agency where you are expected to refer out to psychiatrists or psych nurses in order to get psych evaluations so that your patients can go on medication, maybe it's time to switch your workplaces so that you're not feeling that that's something that you need to do. And in fact, maybe it's time for you to go run your own practice so that you can actually help people heal in the way that you learned how to do it. One of the things that I have learned over the years is that conventional mental health training isn't enough. Hypnosis and neuro-linguistic programming is so much better to help people actually get to the cause of the problem, find out the purpose of why they're holding on to the problem, and helping them reach their compelling future. That's actually the framework that I use for all of my clients to heal. Because there's always a purpose for someone having their problems, always. And the best way to find that is in the subconscious, unconscious mind. And the people who know how to do that is hypnotists and neuro-linguistic programmers. So if you're interested in learning how to do this and bringing this into your practice as a healing modality, I offer a 2-day VIP program. You can do it on a Saturday and Sunday with a 12-month mentorship so that when you're working with your patients, you'll be able to message me and you'll say, I have this patient, this is what's going on. We'd love to have a consult call so you can tell me exactly how to help this person overcome this problem. Then we get on the phone or on the video call, and I tell you exactly what you got to do. And a few days later, you'll tell me, thank you so much, it worked. Because that's what my trainees tell me every single time. I'll leave my contact information down below. So if you're interested in learning more about that, we can have a video call and see if that's something that will work for you. Well, that's all I have for you for today. As always, I thank you for spending your time with me. Till next time. Bye-bye, all.